Good afternoon and welcome. I'm Chrissi Maguire, President and CEO of Mount Desert Island Hospital. Thank you for joining me this afternoon for this very special occasion, the world premiere of our MDI Heroes film. It was March 13th, 2020 when we started this journey through a public health emergency. And I remember that frigid, rainy Friday night 16 months ago when MDI Hospital tested our first patient for COVID-19. That night, everything changed, and we could not have predicted how challenging the last year would be. But because of the hand-in-hand support of our community, the work that our MDI hospital team has completed over the past year is an encyclopedia of teamwork, collaboration, healing, and learning. Although I wish we were together today celebrating in person, I am so thrilled to announce that our island is now over 90% vaccinated against COVID-19. After a year of so much hardship, this number is a phenomenal achievement for our community. This number represents hope for a brighter, healthier tomorrow. And within this number are thousands of heroes who are making a positive difference in our community every day. Thank you for your support of MDI Hospital and for joining us on this journey. And hopefully this will be one of the last times I'm speaking to you through a tile on your video screens. Finally, many thanks to our sponsors and patrons for this very special event today. First and foremost, thank you to today's presenting sponsor, First National Bank, who has been an incredible supporter of our hospital and our community for decades. Thank you to our gold patrons, Dr. Edward Benz and Dr. Margaret Batiste, Sally and Leonard Leo, Jonathan and Sydney Winthrop, and 4 anonymous patrons. And now, without further ado, I am honored to present the world premiere of MDI Heroes.
Maybe it's okay to cry? Yeah. I had a father call me who had been diagnosed already with COVID, and he was working in the respiratory unit, and he said, I'm more short of breath and I'm really scared. And I said, okay, you can come down and I'll evaluate you. I said, you can come down and I will evaluate you. And when he got there, he had 2 kids in the back seat, and they were so scared because they were scared about their father. At the same time, they were scared about what the kids at school were going to say, because they were now a family who had COVID. And I remember that I asked the kids to put the windows down because I knew I was protected. I knew that my equipment was going to keep me safe. And I had them take their masks down. And we kind of touched each other's hands. I said, it's going to be okay. Your dad is going to be okay because their dad was fine. And I said, you're going to be one family that many of your friends are going to go through this. It's just unfortunate you're going to be one of the first families.
Healthcare workers across the United States and in Maine, here in Bar Harbor, have worked very hard in dealing with all kinds of medical emergencies. They have gone above and beyond. They've gone to war, quite frankly. And they have been there in the darkest hours when family and friends could not be with folks that were really suffering with COVID. They were there, they held hands, and that's what makes them heroes to me.
They didn't flinch. They did their duty. They honored their profession. They were able to be in a room and helping COVID patients to get better if they could. And they also were compassionate. As you know, their loved ones couldn't come into the hospital, but they acted as loved ones. They were human.
A hero to me is someone who, in the face of a big challenge, finds somewhere the strength and wherewithal to meet that challenge. It doesn't always mean that it's going to be a successful outcome, but that person who doesn't run away, who moves toward whatever it is and does their best, that to me is a hero.
It means sacrifice. Those who put themselves at risk for the safety and well-being of others. So we think about when the pandemic started, healthcare workers who put themselves at risk when we really didn't know the dynamics of COVID. So those are heroes to me.
A lot of unsung heroes, especially in the hospital. We have cafeteria workers, we have the housekeepers, we have CNAs, all the people who are helping things perhaps behind the scenes.
The management and MDI, those who supported us, who gave us the equipment that we needed, those are heroes. Moms and dads, community leaders, those are heroes. Team members who stayed together during the pandemic, those are heroes. So there are many, many heroes.
I think particularly early on, everybody was really scared. In the hospitals where everybody turned. We relied on their guidance, we relied on their input to help us.
You're hearing about all these new cases on the news, and it's like, is it going to come here? Is it going to hit us? And then, we're finding out very quickly all of a sudden that it is here, it is going to be affecting us. We need to do something now.
Like everyone, we had questions, and the questions continued. And the great thing was having a hospital in our own town that was answering those questions.
So we were able to support our community in a lot of different ways. So not just providing masks to front-facing employees, but we were able to set up social calls to people that, were isolated at this time, didn't really have a lot of support. And we provided a call center or a COVID hotline.
The communication, though, is often the most important thing that you can do for a community who is not sure who to trust. And as a public health beacon in this community, the hospital not only needed to be the leader of developing and disseminating the communication, we wanted to be that key member.
All the doctors that we worked with and all the nurses and stuff were local. So when the residents would call, or when the visitors would even call, they knew the people they were talking to. They knew that they could trust them and they could count on them. And they felt safe.
I remember having conversations with people and sharing some of the information I'd received at the COVID Task Force. I'd say, oh, Dr. Kufler said this, or Dr. Krevin said that. And the response being like, oh, I know Dr. Kufler.
That's right.
I know him from this, that, or the other. And it was that sort of connection that made people think, oh, well, I know and trust this person. So this information that I'm now hearing secondhand, I know is valid, and I can trust the source.
In the year 2019, during the month of December, I was not feeling very well. So I came to the emergency room. I was diagnosed with multiple myeloma bone cancer in my spine. When you're diagnosed with cancer, that's pretty frightening. And especially, as it turned out, I'm older, my immune system was compromised, and along came COVID-19. And so I had a lot of strikes against me. But the hospital staff said, keep going, keep going. They included me into the family right away. And so that made me feel much more comfortable about coming here.
For me, community means everybody taking responsibility. And I was particularly impressed with the MDI community as a whole. I'm not talking about MDI Hospital, but I'm talking about the whole island. And people really stepped up and really embraced the need to protect each other. And that's what community meant to me, was that it could have been a disaster here last summer. We saw the disasters in other places of the country, but our community remained relatively safe.
I think the close-knit part of our community that's always made MDI unique, it really shined, because individuals came from every direction, wanting to share information, wanting to make masks, wanting to help in any way that was possible. And it was a feeling of where we all were equals and we all had something to offer.
I think it's just caring for one another the best way you know how. Even if it's just drop a note in a mailbox to let an elderly woman know or man know that you are thinking of them in this trying time, even though that they're secluded, that, you know, we're still thinking about them. And I think our community did step up and do that.
Our community rallied behind us. They were so supportive. When we thought we didn't have enough protective equipment, we had individuals making face coverings for us. When the community knew our healthcare workers were not leaving our hospital because they wanted to be available to care for them, they brought us all sorts of food. This community rallied not only through these contributions of effort and support, but they supported us financially, through donations, through in-kind giving.
Seeing Bar Harbor as a ghost town was scary. When we found out the vaccines were going to become available, I was really excited about that because I wanted to see people again. I wanted to see those businesses open. I wanted to be able to talk to people and hang out with people again. Knowing that the vaccines, what I was doing was enabling those businesses to open, enabling people to be able to get back together again, I can't even tell you what that means to me.
We started with a very small group of saying, what would that look like? How would we do mass vaccination clinics? And we started our planning. And we started that planning early with assuming that we'd only have 50 doses at any given time to give out to the community. And how would we prioritize groups of people? As we worked through this, we continued to gain more information and really grew our plan so that in December, 1 week prior, we were told that we were going to get the doses.
We had the facility that was one of the better places for the whole island to come to and from to get their vaccinations.
So at one point I was trying to manage a schedule for 900 people to get their vaccine all in 1 week, which is something I never thought I would even be capable of doing.
The first vaccine clinic is such a wonderful story. It was super seniors who had not been out of their homes or their residences for over a year. It was not only a celebration of hope, but of seeing human beings again, that they had not had an opportunity to socialize with. So not only was it joyful, there were tears of celebration because the vaccine was here, but they were just so excited to be able to socialize again.
We had people telling us they hadn't been outside their house since the beginning of the pandemic in March, and so they were really nervous about being out. But as they got there and they saw their friends, we had people dressed in full uniforms. We had suits, ties, vests, long sleeve shirts. And so we ran into some challenges because we had to undress people to get to their arm to give them the shot.
Everyone was so hopeful and so excited and so inspired to be doing something positive, and progress was being made. They all dressed up. We had a hard time getting them in and out of their clothes because it was cold outside, and they wouldn't leave. It was like a party.
They were happy to see their friends again, and they hung out together, sometimes too long. And everybody that was working there was so excited. All the people that came in to get vaccinated were very excited because this was the beginning of the end, they felt like.
And there were tears of joy, which brought tears of joy to all of us to be able to deliver on that hope.
We saw the opportunity to serve our community by getting vaccinations out. The organization, from Chrissi down, we had 100% support. Chrissi looked at me and said, "Trevor, make it happen." And for the last 6 months, we've been making it happen, giving over 10,000 doses and just moving forward. We're not heroes, we're just people that had an opportunity to help out and serve and do the best we could, and that's what we've done. The community members who have come in and got vaccinated are truly the heroes, and they're the reasons why we're able to take off our masks and that we haven't seen the levels of COVID continuing to increase and seeing the benefits in our community and throughout our state and throughout our nation.
throughout the pandemic, for me locally, I think our heroes were Art and Chrissi from the hospital.
Yes.
Their leadership through this whole unknown situation was just inspiring. Their goal was to support not just their organization, not just their staff, but their patients, our customers at our businesses, and the community at large. I mean, I think without their leadership, I think we would have been in a much different situation here on the island.
They were always there for you. They were always listening. They were always trying to guide. Our healthcare hero, I think, was MDI Hospital.
And I think often about our Birch Bay Retirement Village and our residents. But so much was put on the team at Birch Bay. We wanted that pristine bubble to protect our most vulnerable population. And that team not only had to be the emotional caregivers, the friends, the family, but the caregivers for over 16 months. And that was such an amazing effort of resiliency. So when I think about one special moment, I think about recognizing the fact that they were so committed to taking care of our residents. And we're so grateful that I can tell you today they are healthy and vibrant and doing so well.
So I'd like to thank MDI Hospital, healthcare workers across the state and the country, but our folks here locally, you know, they just went above and beyond to be there as surrogate family members for people that were just in the darkest hour with this pandemic and the disease that came with it. I just admire everything they've done, the hours that they put in, the family time that they gave up for the support that they gave to their patients. It's truly admirable.
I would like to say a major thank you to all of our community members in the MDI regional community, to our incredible healthcare workers in the MDI hospital family, for all working so tirelessly together to take care of each other, to support each other. It takes such bravery and courage to do the work that had to be done in the hospital and in the community. And so thank you for everyone for pitching in to keep our community safe and to take care of one another.
I think we sometimes on the island take the MDI hospital for granted. We take it for granted that the hospital is going to be there for us and that the emergency room is there and that we will be cared for. And that's preposterous. Not every community can have a hospital, and not every community has an independent hospital who is making decisions based on the best and service to the community they serve and the kind of issues that have arisen before that they can learn from. So, can't say enough about how important and how grateful I am just in general about the hospital.
I grew up on this island, probably die on this island, and to be a part of a hopefully once-in-a-generation pandemic, as successful I think as we were as a community to get through it together, did feel pretty special.
And time has sort of stood still, and it's like all of a sudden life is starting again. I'm looking forward to things again.
And I am proud to announce today that because of the absolutely outstanding treatment, mind, body, spirit, I have had here at Mount Desert Island Hospital, I am in remission from my cancer.
I am so grateful that we have such an amazing community. I am so grateful for the workforce and the team at MDI Hospital and Birch Bay Retirement Village. I am so grateful for our donors, our supporters. So those are the things that I'm most grateful for, that we are healthy, that we mitigated this disease, we had low positivity rates, and that we are over 90% vaccinated.
When you walk through a storm, hold your head up high and don't be afraid of the dark. At the end of the storm is a golden sky and the sweet silver song of a lark. Walk on through the wind, walk on through the rain. your dreams be tossed and blown. Walk on with hope in your heart, and you'll never walk alone.
I hope that you enjoyed this very special presentation. I am so grateful to everyone in our community who makes all of the work you just saw today possible. Truly thank you from the bottom of my heart. From testing and mass distribution to our incredibly successful vaccination program, our island remains safe and protected. MDI Hospital and our caregivers would not be here today without you, our beloved Mount Desert Island community. Thank you for standing with us. Together, we are stronger and ready to face whatever comes our way, now and into the future. MDI Hospital is fully committed to being here for our community, through thick and thin, and ensuring that your caregivers are always able to lead the way to a brighter, healthier tomorrow. Today, I am thrilled to announce that in honor of you, our amazing community that is filled with heroes at every turn, we are renaming our annual fund to the MDI Heroes Fund. In every act of generosity, every act of gratitude, every act of giving, you become our hero. You are a hero to your doctors, to your nurses, to your neighbors, and to your loved ones, who will always have access to innovative, compassionate healthcare at MDI Hospital because of your support. And now I am inviting all of you to become a hero today. Please join us by making an inaugural donation to our new MDI Heroes Fund. You may do this by clicking the link in the video's description to donate now. Your gift will empower MDI Hospital's life-saving work, now and in the future. Because together, we can be heroes. So thank you again for joining me today and for your ongoing commitment to the health and vibrancy of this wonderful island community. Have a delightful evening and a healthy, happy summer.